Today we're going to be talking about vital signs, and by vital signs we mean these four different measurements: blood pressure, pulse or heart rate, temperature, and respirations. So first off, we're going to talk about taking a blood pressure. A blood pressure is written as a fraction. So 120/80 is how it would be written. There's two different numbers. The top number, which is the systolic number, is measuring the pressure that the blood exerts on the arterial walls as the heart is contracting. The normal range for this number is 100 to 140. The bottom number is the diastolic, and it's the pressure that the blood is exerting on the arterial walls when the heart is resting. And its normal range is from 60 to 90. So we have the systolic on the top and the diastolic on the bottom. So blood pressures are always written as this as a fraction. To measure a blood pressure, you need two different pieces of equipment. You need a blood pressure cuff. The official name for that is sphygmomanometer, and you now know why we call it a blood pressure cuff, because that name is horrendous. But we need a blood pressure cuff and also a stethoscope. Blood pressure cuffs come in different sizes, so one of the main things we need to remember is that we need to make sure that we have the proper size cuff for the patient that we're taking the blood pressure on. They come in different sizes. This is an average adult size cuff. There are ones that are smaller, so they're narrower and not as long, and then there are ones that are large adult cuffs, which also can be used on a thigh, and they are wider and also longer. So how the blood pressure cuff works is it has a bladder inside of it, which is basically made out of rubber material similar to like a bicycle tire. And it is just on a certain area on the cuff from here to here. So that's why it's important to make sure that we have the cuff positioned properly on the arm when we take a blood pressure cuff. And then it has Velcro that is going to secure it to the arm. And this is the dial, how we're going to read the blood pressure to get our numbers, our systolic and our diastolic. Blood pressures are measured in millimeters of mercury. And so it's going to be written as this: mm, millimeters of Hg, which is the chemical symbol for mercury. So this is our dial, like I said, that is going to indicate our numbers. And then down here it also has this bulb that we're going to be using to squeeze to pump up the bladder inside that is going to put the pressure on the arm. Then it has this little dial here that is basically a screw, righty-tighty, lefty-loosey, on how we operate that. So in order to start our blood pressure, we want to make sure that there is no air in the blood pressure cuff, in the bladder, and that our dial is turned all the way to the right, righty-tighty. This blood pressure cuff gives you arrows showing you where you're going to line it up on the patient's arm. For blood pressure, we're going to use the brachial artery, which runs along the inside of the arm. So we want to place the blood pressure cuff centered on this upper part of the arm and about an inch above this antecubital space. And again, lining that arrow a little bit slightly to the inside over that brachial artery. So we will put like I said, we'll put the blood pressure on the cuff on that arm, making sure it is snug and it is fit, and it will stay in place on its own without sliding down. And then for the stethoscope, first we want to make sure that the stethoscope fits properly. When you put the stethoscope in, you want to make sure that the ear pieces are pointing slightly away from you. That is going to make it comfortable in the ear canal. These ear pieces do bend, so they can be twisted and turned to a comfortable position for your ears. And again, they should be pointing slightly away from you. On this part of the stethoscope, there's two different heads. There's a diaphragm and a bell. The diaphragm is the side that we are going to be using when we take our blood pressures. So we don't need to worry much about the diaphragm side right now. So first off with blood pressures, it is important to learn to be able to know how to use the blood pressure cuff properly first before you focus in too much on worrying about listening and getting the blood pressure right off the bat. We want you to be able to become very proficient at operating the blood pressure cuff and then honing in on getting it down to the exact little measurements. As I said, it is measured in millimeters of mercury, and each of these little lines represents 2 millimeters of mercury, and so blood pressure manually is always going to be even numbers. So we're going to put the blood pressure cuff on our patient, and then we're going to pump it up using nice, firm, big pumps with our bulb. You don't want to do little pumps, nice, big, firm pumps until we pump it up to 180 millimeters of mercury. And then we are going to slowly, with our little dial here, slowly start to release the air in the cuff. And then we're going to have at the same time, we're going to have our stethoscope on, placed over this brachial artery, and then we are going to listen until we can hear the heartbeat. So as we slowly release that air, the dial here is going to, the needle is going to slowly go down on the dial, and then we're going to start hearing the heartbeat. So that first heartbeat that we hear, the number that is closest to that is going to be our systolic blood pressure. We're going to continue to release the air from our cuff gradually, and this becomes a practice to getting this time right so that we're not leaving it on the patient's arm too long and hurting their arm. But gradually releasing that until we hear it for a last time. That last number is going to be our diastolic number. So we should have those two numbers from where we first started to hear the heartbeat and then when we stopped hearing the heartbeat. And those are going to make up our two numbers on our blood pressure. Oftentimes in patients, especially young teenage girls, you might not hear, we might be able to hear the heartbeat all the way down to 0. But there usually is a change where you're going to hear the strength of that heartbeat is going to change. So that where that changed from being a louder sound to a softer sound would be used as your diastolic number. Taking blood pressures, you have to, when you are tested on this, you will need to be within 4 millimeters of mercury either way on both of your numbers. So it is very important to get very accurate with taking your blood pressures and not just simply going with increments of 10, 120 over 80 type thing. We want to get down to the very precise little numbers that are in the blood pressure. And we want you to become very proficient at manual blood pressures because it is an important skill that you're going to take with you throughout your lifetime as a nurse. Most facilities have manual blood pressure cuffs, but it is still very important to be able to take blood pressures manually.